Everybody stand. We'll do the Pledge of Allegiance. Thank God bless America. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. God bless America, land that I love. Stand beside her and guide her through the night with the light from above. From the mountains to the prairies, to the oceans white with foam. God bless America, my home, sweet home. God bless America, my home, sweet home. Mark, do we have inspirations today? How do we sound? Wait a minute. How do we sound, Ken? Good? Okay.
All right. In honor of our speaker today, our moments of inspiration have all to do with animals. Animals are the bridge between us and the beauty of all that is natural. They show us what's missing in our lives and how to love ourselves more completely and unconditionally. They connect us back to who we are and the purpose of why we are here. That's a quote from someone named Tricia McCaw. Another one, a little brief one here. Some people talk to animals. Not many listen though, and that's the problem. And that's from A.A. Milne of Winnie the Pooh. One more thing here. I've got a couple of them. Let me pick out another one. If having a soul means being able to feel love and loyalty and gratitude, then animals are a lot better off than a lot of humans. And that's a quote from James Herriot, who wrote several books about animals and the care of animals.
Thank you, Barb. Yes.
All right, thank you, Neil. Well, here's a second half of the Fisher presentations. Oh, before I do though, Barb, I would like to add one inspiration to your list of great quotes. So this is from the great Winston Churchill. When asked what he thought of animals, he said, "I'm fond of pigs. Dogs look up to us, cats look down on us. Pigs treat us as equals." All right, so it gives me great pleasure to introduce Kristen. Kristen is my daughter-in-law, our daughter-in-law, and her husband, Alex, who is our youngest son, happened to be in the area and join us. Alex is the proprietor, owner, and operator of A.J. Fisher Company. So if you see the signs around, that happens to be his company in the area. So just how Kristen ended up in our family is pretty interesting. Logan, who spoke a couple of weeks ago, when he was getting married, Alex was his best man, and Kristen was the maid of honor for Christina, who's now our other daughter-in-law. Both graduated from the Ohio State University, were roommates out there. Anyway, Kristen and Christina met at the, or Alex and Kristen met at the wedding of his older brother. And a couple of years later, we had Kristen as another daughter. So worked out really well. Really well. All right, so let me tell you a little bit about Kristen. She could then launch into her very interesting discussion here. So Kristen studied zoology and earned her bachelor's degree at the Ohio State University. Which is, I guess they have that
Trademark.
trademark.
Yeah,
So
it's trademark.
we have to include that. She graduated from Western University of Health Sciences College of Veterinary Medicine, which is out in Pomona, California, and completed a 3-year residency in pathology at Purdue University. During her residency, she received her master's degree in comparative pathobiology. We have a lot of nice conversations on pathobiology. So, Kristen is board certified by the American College of Veterinary Pathologists. She's presented several times at national professional meetings, frequent lecturer in veterinary clinical pathology to undergraduate and veterinary students, and on veterinary techniques, intern residents, and veterinarians. She's participated in numerous studies involving a variety of specialists and species, and enjoys working closely with clinicians. Kristen has served on the Board of Trustees for the Pennsylvania Veterinary Medical Association, the Executive Board of American Society of Veterinary Clinical Pathologists, and is a committee chair for the American College of Veterinary Pathologists. Her clinical interests include hematology, surgical pathology, and cytology, clinical chemistry, and infectious diseases. Her goal is to make clinical pathology understandable, if that's possible, and easily accessible to, and provide accurate and timely results to facilitate diagnosis and treatment, which is what she does very well at her place of employment, which is the Valley Central Veterinary Referral and Emergency Service in Whitehall. She lives here in Easton with our son Alex, their two sons, Will and Sam, and they also have a great new addition to the family, a Dalmatian puppy by the name of Pup. So that comes a great addition to the family too. So it gives me great pleasure to introduce Kristen. Thank you.
Hi, everyone. Thanks for that not biased at all introduction. Thanks for being patient with me and rescheduling. I got COVID from our 3-year-old who likes to breathe in my mouth.
You're good.
You're good. You can hear me now. Okay, great. So I thought when my father-in-law asked me to talk to you guys today, I thought about what would be a good topic. And probably the #1 comment I get when I tell people what I do is that they didn't know that there were specialists in veterinary medicine. So I thought maybe I could go over a little bit about specialty practice in veterinary medicine, but it's a very informal talk. So if at any point you have any questions, just go right ahead, raise your hand, ask it, scream it, whatever you'd like. That is Poe. He is now 10 months old and he is about as energetic as our children. We have our hands full. And just like my father-in-law said, I work at Valley Central Veterinary Referral and Emergency Center. We're right off of 22. Does anybody here have pets, or is everybody?
We've been there.
Yeah. Usually if you've come to us, it's not great. Hopefully you've had a good experience, but if you have to come to us, it usually means your pet is really sick. And another vet can't figure out what's going on, or it's an emergency and all the other hospitals are closed. So to segue into James Herriot, this is probably most people's first experience or general experience with veterinary medicine. The old school, treat every animal, every species, come to your house, usually give them a shot, and trade you for a basket of eggs, right? Or a chicken. In his stories, we always hear about how people can't afford, so he takes 2 chickens or something like that. Or even some of our TV doctors who are doing very similar things. It's kind of one size fits all medicine. They treat the cows the same way they treat the pigs, the same way they treat the dogs and the cats. Veterinary medicine has actually come a long way from this. When we started out as a profession, it was mostly food animal and production medicine. So large animals, horses, cows, pigs, things like that is what the veterinarian was doing, making sure our food supply was safe. Within the past few decades, it has really switched to small animal medicine, our companion animals, so dogs, cats. And with that switch, it became less about money. So when you're dealing with large animals with food production, if you're going to slaughter them for food, you don't want to throw all of your money into that animal. You want it, as a farmer, you want it to be a sustainable profession. But when it's your pet, you're doing it for both their comfort and your mental well-being. So that's kind of where the switch came, and why medicine, veterinary medicine in specifically, has really amped up its capabilities. So I thought I'd start really quickly with what it takes to become a veterinarian. So once you graduate high school, then you go to your undergraduate and you have to complete specific coursework. So you could major in just about anything. You could major in art history. You could major in zoology. You could major in anything as long as you complete the prerequisite coursework. It usually is biology, organic chemistry, biochemistry, things like that. Nutrition. I had to take a speech course. I think they should include a psychology course because you're talking to a lot of people. So, but currently most vet schools don't require a psychology course. And then you apply to vet school, and you usually have to take an entrance exam like the graduate test or the MCAT. And the people often say that vet school is harder to get into than med school. And the reason for that is there's only 28 accredited vet schools in the country. And each school only takes about 100 to 150 students a year. So it's a lot of people competing for not a lot of spots. So then vet school itself is about 4 years long. The first 2 years are usually heavy in your coursework, your understanding of diseases, medications, things like that. And then the last 2 years are clinical work. So you're usually in the clinics, you're with specialists and other doctors, and you're learning from the patients. Once you've graduated from vet school, the next step is to take the national board exam. And then once you pass, you have to decide what state you're going to become licensed in. And then each state either has an additional board exam or like a jurisprudence test where you just have to get to know the laws relating to practicing veterinary medicine in that state. And then plenty of veterinarians, new graduates, when they graduate, they don't feel like they have had enough clinical experience, or they decide they want to go ahead and specialize. And if you're going to do that, you need to first do an internship, which is 1 year long, and then a residency, which is 3 years long. So if anybody's counting, this is 12 years after high school. So what is a veterinary specialist? Well, I have the definition for you. A board certified veterinary specialist is a veterinarian who has completed additional training in a specific area of veterinary medicine. Usually that training is 3 to 4 years long. And then they've passed an exam that evaluates their knowledge and skills in that specific area. So the exam is usually broken up into 2 parts. There's usually a phase 1, then you pass the phase 1 in your second year of residency, and then after you've finished your 3rd year, you take the phase 2. Currently, the AVMA, which is the American Veterinary Medical Association, recognizes 22 specialty organizations. They include anesthesia, animal welfare, behavior, dentistry, dermatology, emergency and critical care, internal medicine, laboratory animal medicine, microbiology, nutrition, ophthalmology, pathology, pharmacology, poultry medicine, preventative medicine, radiology, sports medicine, surgery, theriogenology. Does anybody know what that is? Yeah, it's specializing in reproduction. So those are the ones that make sure all of our horses are bred correctly and all of our cows are bred correctly. And these are the ones that basically supply our whole meat chain, because we like our dairy cows to be similar, or our meat cows to be similar, or they're in charge of making sure that thoroughbred horse, that one, whatever race is his sperm, is appropriately distributed. So that's what theriogenology is. Toxicology, veterinary practitioners, and zoo medicine. And within these specialty organizations, there are subspecialties. So internal medicine is general internal medicine, just like we have in human medicine, and then also includes our cardiologists and our oncologists. And then pathology, which I'll talk about a little later, includes both anatomic and clinical pathology. And then the veterinary practitioners actually is composed of veterinarians who specialize in a single species. So dogs, cats, horses, pigs, rabbits, you have to be well versed in one single species to get to pass that board. At our hospital, Valley Central, we have specialists in emergency and critical care, We have 2 general internal medicine specialists. We have 3 cardiologists. We have 3 oncologists. We have 2 board certified ophthalmologists. We have a clinical pathologist, and we have 3 veterinary surgeons. And besides these specialties, we also offer acupuncture and holistic medicine. And we have a great emergency team full of many emergency doctors. We have nuclear medicine, which cats, as they age, tend to get hyperthyroidism. So instead of treating it with a daily pill, we can use radioactive iodine to target that thyroid, and it cures hyperthyroidism. We have a fully serviced blood bank, which we use for our in-house patients, and also we make available to hospitals around the Lehigh Valley. And we have a CT and hyperbaric oxygen chamber. Is everything okay?
Oh, yeah. Vic,
Okay.
He didn't get his email, so I
Oh,
got
okay. As long as they can hear me. So that's what we have at our hospital. I'm just going to go back 2 slides. Before I go specifically into pathology, which is my bread and butter and passion, does anybody have any questions about any of these specialties? Yeah.
I'm familiar with sports medicine because I
Yeah.
have rotator cuff surgery. What is sports medicine in an animal?
So sports medicine is broken up into large and small animal. Our large animals are going to be the horses, the race horses. So they are very specific to race horses, and our small animal sports medicine doctors are mostly, they were the greyhounds, which greyhound racing is now illegal in Florida, but it's also hunting dogs and sporting dogs. So they focus on those dogs and basically how to make them their best. In terms of orthopedic surgeries, that falls under the surgery category. Like our surgeons do probably about 15 knee replacements or ACL tears a week. You know, that is probably one of our more common procedures. We do full hip replacements. A lot of those orthopedic surgeries actually started out in veterinary medicine.
You may cover this later. And I'm
Yeah.
sorry if I'm-
No, this is, yeah.
For all of us, we have health insurance. Is there health insurance for animals?
Yeah, yes and no. There is veterinary pet insurance. However, you have to make it affordable, you have to get it at the time your pet's a puppy or a kitten. Otherwise, it just is too expensive, and it almost always excludes pre-existing conditions and anything genetic. So anything that your dog's breed is predisposed to, it won't cover. So owning a pet is a privilege, not a right. And you and there is definitely there's large discussion in our field, you know, where's the right stopping point? You know, how far do you go? We would never want somebody to go into debt or bankrupt to save their animal, especially if it's only going to buy them a month or 2. But if we can give them a year or 2, that's different. And in terms of oncology, people often worry that giving chemotherapy or radiation to their dogs is going to be traumatic, but it's very different in veterinary medicine because our focus is not to cure cancer. We are not trying to make this animal live forever. We are not trying to remove the cancer from them. We are merely trying to make them more comfortable. So they never lose their hair. Sometimes their side effects from chemo are a little bit of vomiting, a little bit of uncomfortableness. They're never hospitalized like human patients with chemo. We usually give the medication and then we send them on their way. So it's a much different practice than human oncology. Yeah.
Well, you and I both worked for the police department. We were around canines.
Yeah.
You were a canine officer. And I understand from many of our canines that they have a problem with hips.
Yeah,
Is
so
that
you had the,
something that
so you guys had the shepherds, I assume, which is partially why they are moving police dogs over to Malinois, which I have a soft spot for, that we just put down our 14-year-old Malinois. because the shepherds were bred to have very sloping hips, and that slope is what kind of led to hip dysplasia and neurologic issues in their back end. So while they were great police dogs, they really had a lot of hip issues. We have plenty of medications that you can give them in terms of arthritis medication and protectant. Like I think a lot of people take glucosamine and chondroitin supplements. It's the same in animals. But in terms of the working dogs, sometimes we have to retire them early because they're in so much pain, which is why there's kind of that switch over from the shepherds to the Malinois. You're welcome. Any other questions about any of the other specialties? Yeah.
One thing I'm concerned about is exotic care animals. For
Mhm.
exotic animals, I have a guinea pig,
Mhm.
and trying to find one in the area has been difficult for him.
I know. Part of the issue is that it's veterinary school's 4 years, right? So you can't teach every species in 4 years. You can teach how to learn about other species, but then you kind of have to have a passion for the small exotics. We are in a shortage of veterinarians as is, so it's felt even more in the exotic population because something that was already small is now even smaller.
Right.
I recommend if you're looking, most Banfields,
Okay.
because they're in PetSmarts,
Okay.
those doctors have to have a little bit of exotic experience. So that's usually where I say, hey, just try and go over to at least call. That's what I told our daycare when they asked me to look at the guinea pigs. And I said, well, I can look at them. Yeah.
Okay.
Yeah.
That would be helpful.
I want to ask you a question. An article in the local Easton paper
Mhm.
this week about between last year and this year, there's dramatic difference in the death of racehorses in Pennsylvania. Did you see that article?
I didn't see that specific article, but I know that they just arrested a lot of people in Pennsylvania in regards to the drugs.
Right.
It is a very dangerous sport to be in as a professional because your license is on the line, even if the track owners are doing something without your knowledge. How you get around that, I don't know. The laws are on the books. It's a federal offense, but there's so much money behind racehorses
Right.
that people don't care, and they do whatever they want to, basically. So, yeah. I'm sorry, I didn't have a better answer for that.
No, that's a good
It's
answer. That's said about drugs.
Yeah.
It's all this stuff behind the scenes.
Yeah, it's
not good.
Yeah, and most of the time it's behind the veterinarian's back. They're black market drugs. They're doing it themselves.
Oh, money.
Yeah, exactly.
Right?
Yeah, it's all about money.
Yep.
So, any other questions about any of the other specialties? Dermatology is a big one. Itchy dogs. People cannot get over their dogs keeping them up at night because they're scratching themselves at the end of the bed. That's probably one of our more popular specialties these days. We have some great allergy drugs now that very specifically target the cells in the body that cause the allergic reaction. And so they have very little side effects. It's really cool.
Kristen, I have a quick question.
Yeah.
Maybe you're going to cover it in a minute, but how frequently do veterinary drugs transition to human use?
Usually it's the opposite, but I will cover that because drug development is very specifically a veterinary pathologist's job, both human and animal. So, but more often than not, the drug is approved for human use. And because to get to the human use, you have had to have animal trials, it's very easy to get it approved as an animal drug because you already have the studies.
Well, Bill's doing that. I do have a question.
Yeah.
Years ago, we had friends that owned a farm, and we were with them And during that occasion, one of their farm animals was going to give birth. And we were there, and our friend, I mean, maybe I'm wrong, but it looked to me like she put her arm way up there.
Oh, yeah.
And pulled that.
Yeah.
little- I mean, is that common, I guess?
Yeah. My parents actually have a picture of me with my hand all the way up there from vet school in their house. So, yep. Yeah.
So you
Yeah,
don't need
you
a vet
can-
for that.
I mean, so the rule of thumb with animals, actually the actual written law, is that you can practice veterinary medicine on your own animals. So you can do whatever you want to your own animals, as long as you're not bordering on cruelty. When you start to do it on another animal or charge for your services, then that's practicing veterinary medicine without a license.
Try it, yeah.
There we go. It can get gray, because especially in farms, the farmers, it's hard to get a vet out there, and they have worked with these animals their whole lives, and so they know what they're doing. We just want to, everybody's just trying to look out for the animals and make sure that they are as comfortable as possible. Usually the vet doesn't get called in unless the calf is stuck. I don't know if it was a cow. I'm assuming it's a cow. Yeah. If they're stuck, then that's when the vet gets called in. So, or if there's twins or something like that. All right. So the American College of Veterinary Pathologists, that is what I am lucky enough to be a member of. We were created in 1949 and officially recognized in 1957. And we are the oldest recognized veterinary specialty. And the reason this is because we are about as far from veterinary medicine as you can get. So I tell people I am a veterinarian, and occasionally I do practice some small animal medicine just so that I can do an exam every once in a while. But our specialty is by and large related to humans. We have over 2,000 members, and we're in about 17 different countries. Our members have roles in academia, diagnostic labs, industry, state and federal government agencies, and very rarely you can find us in veterinary hospitals. We are divided into anatomic and clinical pathology pretty unevenly. Anatomic pathologists are like about 3-to-1 to the clinical pathologists. I'll try, since we're eating lunch, not to be too gross, but they're what we're used to seeing on TV for a human pathologist. They do the necropsies, which is the animal equivalent of an autopsy, and they look at tissue samples to check for disease. So what in general is veterinary pathology? It's the study of animal diseases in a variety of species, mostly with human implications. It provides the scientific foundation for the practice of both human and veterinary medicine by studying how a disease develops and how it progresses. So, and it's pretty crucial. The term One Health is what's used to describe diseases and things that affect both humans and animals. And it's a way of bringing everybody together. Veterinary pathologists are at the forefront of that. So you can imagine these past couple of years have been very veterinary pathologist heavy. Because basically we study diseases from live animals to the specific proteins that causes disease. We want to know everything. A pathologist wants to know why. We always want to know why. We don't want, this is just how it happens. We need to know exactly how and why a disease happens. And when we figure that out, hopefully that leads to easier and better treatments. So like I said, disease diagnosis, that's primarily what I do. I am responsible for making sure the patients that come into our house, depending on what sample is submitted to me, that we have a correct diagnosis, and I can lead the other doctors in a better treatment path. Research is a common place for veterinary pathologists because they have a very core understanding of diseases. So they know how to develop research projects to get those diseases understood. And then the majority of veterinary pathologists, both anatomic and clinical, are at drug companies. So anytime a new drug, treatment, anything that needs to be FDA approved, it absolutely has to go through animal models. And it cannot pass the animal model studies without a sign off from a veterinary pathologist. So it's an extremely important job in that if you say this drug is not toxic to these mice, and then it goes to humans and it is toxic and you missed it on some of your findings, then that has some serious consequences. So that is where the majority of veterinary pathologists work. And that's why probably our specialty was the first specialty, because it's so different than what other veterinarians do. Here are some things that veterinary pathologists have been a part of. I'm pretty proud of that first one. My mentor in vet school, before she taught, she was at the Bronx Zoo. She was a veterinary pathologist at the Bronx Zoo, and she noticed some birds were dying, and she discovered that they had West Nile virus. And so she was the first person to find West Nile virus in North America. And then she helped convince me to go into pathology. So we have conducted experiments on the space shuttle. We respond to environmental disasters such as any nuclear accident like Chernobyl or the oil spills. And anytime our military goes anywhere new, before we send any troops, they send the veterinary pathologist over to check and make sure there's no foreign diseases that could be caught by our soldiers. So there are a significant amount of veterinary pathologists in both the military and in state and federal agencies. And we perform some pioneering stem cell research. Some of the more common reasons we use stem cells in veterinary medicine is for, we use them for knees. So when they have knee issues, we can inject stem cells, or if they're having bone marrow issues, we can do that. But in terms of human research as well, that usually starts out as a veterinary pathologist.
One second, Bill, I'm gonna shut this off, or you're gonna pick up all the.
Yeah, you can shut your mic off, yeah.
All right, so my specific specialty focuses, which is clinical pathology, focuses on diagnosing and disease monitoring specifically through blood, bodily fluid secretions, and tissue specimens. So great lunch topic, right? Our main areas of expertise include clinical biochemistry, which I never would have guessed when I was in undergrad and struggling through my biochemistry course that would be my life. That's all I do. Hematology, which is the study of blood. That's my favorite. Hemostasis is blood clotting. Urinalysis. Cytology is evaluation of single slides, or cells. So if patient has a mass and the doctor pokes it, they send it to me and I tell them what that mass is. And then advanced diagnostic testing ranges anywhere from PCR to advanced tumor testing for different types of lymphoma, things like that. And then how are we on time? I just have some pictures of slides that I look at because I look in a microscope all day. So I just thought I'd show you some fun stuff. This is full of bacteria. That's a squamous epithelial cell, and it's full of bacteria. Those big kind of cigar-shaped bacteria, those are only found in your mouth, right? So if I see a sample and the owner swears up and down, they are not letting their dog lick their incision. I am not letting my dog lick the incision. I have the e-collar on all the time. I see that bacteria, I know they're lying to me. So this is this is a tumor called a TVT. It is actually the only It's a sexually transmitted tumor. It's one of the only tumors that actually happens with, and it is found in dogs, mostly in South America, Central America, but we have, this case was from Texas. And it's also found in Tasmanian devils. So that's, yeah. But the good news about this tumor is that it goes away with one treatment. We can cure it, so.
Well, it's good looking wallpaper for.
Right? This is a cell. I'm just gonna come up here so I can point them out here. This is a bone marrow sample from a dog, and these little guys right here, leishmaniasis. So that was a dog that had been to Italy with its owner and came back with leishmaniasis. This is fun. This is just a neutrophil, so a white blood cell in a dog. I can just look at this and know that this dog is female because their neutrophils have this little extra piece of chromosome because female chromosomes are longer than males. This is baby heartworm. They say it's called a microfilaria. So if you do not have your dog on monthly prevention, this is what happens. Then these little guys circulate in the blood, and mosquitoes come and they get blood, have these in there, and then they bite another dog and transmit those to another dog. So I strongly recommend you have your dog on year-round heartworm prevention because it's much easier to prevent than it is to treat. This is somebody actually combined blood, but I thought this was fun because I can tell what species I'm looking at based on the cells. So these are eosinophils. They're cells that respond in allergic reactions. The dog has round kind of granules, pink granules. The cat has rod-shaped granules, and the horse has raspberry-shaped granules. So I can know what species I'm looking at just based on that cell. And I can also tell you what breed. So this is an eosinophil in a greyhound. And for some reason, greyhounds, their eosinophils don't have that pink color. They're just clear like that. So I know as soon as I'm looking at that sample that that's a greyhound. These little guys, these are red blood cells. And normally they should look like this. And these have these little clear spots there. They're called dendrocytes. This dog ate garlic. These, we call them little clown noses on the red cells, are Heinz bodies. This dog ate a penny. So, this is a parasite, trypanosoma, that we find in cows. And this is a very fun yeast called Syniclomyces. It does absolutely nothing to dogs, but when I see it in a dog sample, I know that this dog has been eating rabbit poop because it's only found in rabbit poop. And then, so if we look back, you can see these are what normal red cells look like in mammals. These are red blood cells, and this is a bird sample. They have nucleated red blood cells. So do reptiles and fish. And this is an anaplasma. So it's a tick-borne disease. And it gets this little inclusion in the neutrophil, which is a white blood cell. We only see these in the first 24 hours of infection. So the dogs will test negative on our tests for it, but if we see it on the blood smear, we know that they've just been recently infected. And then this is just an electron microscope picture of the same thing. I just thought it was really cool because I got to play with the electron microscope, but here is that's that inclusion right there.
13,000 magnification.
Yeah.
Wow.
It's intense. All right, and then here is some urinary crystals. I just thought I'd show you these really quick. These are calcium oxalate monohydrate. They are pretty much pathognomonic, means there's only one thing that causes them. This dog got into ethylene glycol. Does anybody know what that is?
Mhm.
Antifreeze, yeah. So this dog ate antifreeze. So it causes, when we see these crystals, we immediately know that this dog got into antifreeze. And then
It
finally,
tasted good for him.
that's why they stopped making them sweet. They used to be sweet, and so
Mhm.
now they stopped making them sweet. And side note, any of you cat lovers out there, usually dogs will eat antifreeze like it's a snack. Cats will only eat it if they accidentally walk on it, and then they lick their paws to clean themselves. So we see it much less frequently in cats because they tend to make smarter decisions than dogs. Yeah. These are uric acid crystals. They are due to a defect in protein metabolism, and we find them almost exclusively in one type of dog. So when I see these, I know that I am looking at a Dalmatian. So there is our puppy. My husband took this picture rather than telling him to get down. He took the picture. Does anybody have any questions? That's pretty much all I have for you. Yeah.
I've heard this, I'm sure you can tell me, is it bad for dogs to eat chocolate?
Yes. Yes. Chocolate is absolutely toxic for dogs. Our milk chocolate, there is a straight up calculation you can do to figure out how much they weigh and how much they can eat. So if you have a big dog, they can eat a little bit more than a small dog. And it also depends on the chocolate. So if they get into baker's chocolate, which is just 100% like cocoa powder, that is much more severe than if they get into a milk chocolate.
I don't know if it's an animal thing or whether it's a nutrition thing, but my son and daughter-in-law have 2 lab mix rescues. And on occasion, I'll take them out to walk. I know where it's from.
I already grossed everybody out.
But- For some reason, they always go after somebody else's food.
Yeah.
Is that normal?
Yeah, it's pretty normal. They sell products that you can put in their food to make their poop less appealing, but it's pretty normal and why parasites persist. Right? So, yeah.
This may not be your field exactly,
Yeah.
but when you see these dog shows on TV,
Mhm.
the best pedigrees, the best dogs in the world, and these judges go by and they feel everything, you know.
Yeah.
What do you think? What's your comment on that?
On dog shows?
Yeah.
In
I mean,
general?
How can they tell one dog is so perfect than the next one?
So each breed has what's called a breed standard. And so they are looking for very specific things for the breed standard. So they're not comparing different breeds to each other. Rather, they're comparing the dog to its breed standard. So when it's time for best in show, they're not saying this Dalmatian is cuter than this lab. They're saying this Dalmatian is closer to what our standard for the breed is. And the idea is that a well-bred dog is a good pet, is doing its job like it's supposed to, whether it's a companion animal, whether it's a hunting dog. The closer you get to the standard, the better it's supposed to be at its job. Now, there have been times like shepherds, like where we didn't do it right, and so we bred them low, or Dalmatians where we bred them and now they have these crystals, or they're deaf. Our Dalmatian, it took me a while to find a breeder who bred the crystals out of them. It's pretty rare to find that. All Dalmatian puppies have hearing tests because so many of them were blind or were deaf. So you want to make sure that you're not getting a deaf puppy. So it is not a perfect solution, but ideally it's better than your backyard breeders who are just breeding for money.
Would you mind stepping over so the
Oh, yeah,
people on the screen can actually see? No,
Yeah.
no, step somewhere that they can actually see who they've been hearing.
Hi.
Because when we've got the whole screen set.
Yeah.
they know who's on.
Okay.
Yeah. I have a question.
Kristen, can I ask you,
Go ahead, go ahead.
can I ask you a question from the screen? Kristen, thank you so much for your wonderful presentation. And I enjoyed the joy that you obviously have of dealing with the pets and the science of it all, which brings back happy memories to me as a medical human person, doctor. I wanted to ask you a side question, and that is, what would you think would be the kinds of ethical questions that come up in your area of practice as compared to, say, in internal medicine practice for people?
You mean ethical questions in terms of pathology?
I wonder, in your contact with the people who have the pets, or how far you go with diagnoses, things like that are ethically difficult to deal with. How do you do that? And what
every veterinarian has to handle that differently based on their comfort level. For me personally, I like to not assume anything about people. So I don't want to assume that they have or don't have finances. And I also don't want to assume their relationship with their animal, how important, how far. So the way that I practice is that I give them the gold standard first. And if they, at that point, they tell me, I can't afford this, this is too much, we don't want to do any more, then we start going down and we see what we can shave off or how we can approach something differently. But personally, I don't like to assume anything about people. So I always start with the gold standard. But there is absolutely ethical issues, I think, with letting people spend their life savings on treating a dog that's only going to live for a couple months or even a year. And at the same point, there's never a guarantee in medicine. So you could spend all of your money and you still don't have your pet at the end of the day. So.
Do you deal much with pet abuse? Does that show up in your practices?
I don't, luckily. Depending on, I have friends that do, and we are required to report it. Unfortunately, if you have taken it, even if your animal is abused, if you have taken them to see a veterinarian, that usually is enough for the police department or whoever is investigating to consider it not abuse anymore. So, yeah.
Question.
Yeah.
Daughter Jennifer here, she was talking about her guinea pig recently. Her guinea pig was very sick and trying to find an exotic.
Yeah.
She found one over outside of Phillipsburg. And she called them and they said, well, you can come after 12, we're closed, and we can take care of it. Never mentioned to her that it's going to be more expensive after 12.
Yeah.
And she ended up, and they would only allow her in, so we couldn't be in with her.
Mm-hmm.
And Jenny, how much did you spend? Almost $250, $300 to have an examination and then agree to put the guinea pig down. But there was like a $25 fee plus added to the injection to put the animal down. Why did they give them a sedation while they're going to kill them anyhow?
It is unethical to not sedate an animal before you euthanize it. We do the exact same thing when people are lethally injected. They get a sedative first. It is cruel too. Yeah.
Okay.
Especially in these smaller animals like the guinea pigs. Sometimes you can't find a peripheral vein, and so you have to either stick them in the heart or stick them. Yeah. So it is unethical.
It was hard to understand if you're going to give them an injection that kills them.
Yes. Yeah, but you don't want their last minute.
You got to sedate them first before you kill them. Okay.
Yeah, you don't want their last moments on earth to be scared, and then you also don't want them to be moving because you want to make sure you get it done right the first time.
Yeah, you've answered the question because I was like, why?
Yeah. I mean, yep.
I ask you one more thing. What's the role of the veterinary technician in the practice?
It would easier ask what isn't the role of the veterinary technician. They are our saviors. They do just about everything. There is a current nationwide effort to change their title to veterinary nurses, because that's what they are. They are responsible for all of the patient care, for carrying out all the doctor's orders. They're the ones that are making sure your animal is going outside, eating, drinking, going to the bathroom. They are taking the doctors, making sure that they're doing everything they need to be doing. They're our saviors. So, and they don't make enough money. So.
Yes, I have a question.
Of course.
If you take a zoo like San Diego,
Mhm.
where they have hundreds of veterinarians,
Mhm.
do some of the veterinarians go to extra school to treat elephants?
Yes.
And
Yeah.
tigers?
Yeah. So,
They have what, hundreds of thousands of different animals.
yeah.
So they must specialize.
Yeah. So there is a specialty college of zoologic medicine. So they are trained in how to deal with less commonly seen species. And then also the majority of veterinarians at zoos, there's usually one or two that treat the sick animals, but the majority of vets at zoos are pathologists, because it's more important to know why an animal at a zoo died than to help prevent it from dying, because you're worried about the entire zoo. When one animal dies, you worry, is this something that the entire zoo is going to get? Do we have to empty that whole enclosure? Do we have to clean everything out? Do we have to make sure our staff doesn't go near any of the other animals? So every zoo usually has a veterinary pathologist on staff.
Do they intern at zoos?
They do their residencies at zoos. Usually they do an internship at a small animal hospital or a teaching hospital, and then they do 3 to 4 years at a zoo.
I see. Do they get a special degree for that?
Yeah.
And it's 3 to 5 years?
Yeah, so that's,
On top of the 12?
no, it's part of the 12. So it's on top of the 8, yeah.
Okay.
But residencies can be very hard to get. So there's usually a break in between when you've graduated and you've done your internship and when you start your residency. So it could expand to 15, 16 years. Yeah.
Thank you.
You're welcome.
Why don't we let Kristen sit down and?
Oh, no, you're fine. Does anybody?
If you have any more questions, you can go ahead. But her favorite risotto is probably getting cold.
It's fine. I love it cold too.
Yeah.
Yeah.
One more thought about your specialty,
Yeah.
pathology, veterinarian. It seems like that your field is at the heart of finding out the animal and human interaction in diseases like COVID.
Yep.
And Ebola.
Mhm.
And it would seem to me that there's probably a definite shortage of people. I don't know if that's true, but there's a definite shortage of people.
There aren't a lot of us. There are only a little bit over 2,000 of us in the entire world.
Yeah, well, that's amazing because,
Yeah.
because that's, understand, as there are more of us, and we become more in contact with animals.
Yep,
the,
exactly. Yeah.
Transfer of disease from animals to humans. Bird flu. You know,
Yeah,
it just,
you are 100% accurate. Yeah.
it just seems to me
Yeah.
that's incredibly important.
Yeah, it's hard because it's hard to convince people that have spent their lives wanting to work with animals to stop working with animals. Is basically a pathologist doesn't really work with animals anymore. So people that have tried so hard to get into vet school and do things, and then you say, okay, how about you do this specialty? And you have to have a real passion for science, because it's very right down to the proteins that cause diseases. So it's very, very scientifically oriented. So you're losing all of that interaction with other people. You're losing all the interaction with the animals. So it is a hard, and a lot of people get sick looking at a microscope all day. So I love it, but a lot of people get sick. So it's a hard specialty to fill, and it's a hard specialty to get into. Put-
interesting, because of the level of importance.
Mhm, agreed.
Got more emphasis.
Yeah,
on getting people more
The Army is very big on training veterinary pathologists. So that is one of their big things, is that they try and recruit and pay off your student loans and stuff like that. So,
Definitely national defense.
yeah. Yeah, for sure.
No doubt about it.
You've made veterinary medicine very interesting, and I think there's a lot of non-pet owners here.
Yeah.
And we're non-pet owners, okay? Our kids are pet owners, but
Yeah.
we never have been. We have 4 kids, no pets.
Who cleaned the floor?
Don't forget to turn your mic back on then.
They all have dogs, okay? But thank you. It's very interesting. You're warming up your lunch. And we appreciate it. And any more questions, feel free to ask them.
I was just gonna say to Kristen, those in the set, we are not pet owners. We live with cats who allow us to live with them.
You are the cat's pets.
A dog thinks of you as your friend, your compatriot, your buddy. A cat thinks of you as, excuse me, you're my staff.
Yeah, for sure.
Anniversaries, Sarah Panovich joined in 2015. We have 3 birthdays. We have Joanne, August 13th. We have Janet on August 13th, and we have Gary's here. Gary's still here on August the 28th. So, shall we sing?
Sure.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Kiwanians. Happy birthday to you. I don't think I started that very well.
Yes, I think we should give a big round of applause to Dr. Fisher over there for such a great presentation. And for somebody who's always spending the day looking at a microscope, I can't believe it. It's so entertaining.
I'm gonna teach you guys a round of applause. It's a round of applause.
Thanks for coming. We'll see you next week. And I understand next week, we may be going to have a check award from Serve for the last fundraiser they had for us.